Hi, Dr. Michelle Mars here. Welcome back to session 1 of SOCQ121 BioQ121. In this section we're going to look at the historical period of the Renaissance and coming up to more modern understandings of the body and musculoskeletal therapy in particular. Okay, so the Renaissance period. You're probably aware of the Renaissance period from, if you've ever watched a kind of period drama on TV. It's a period in time when mercantilism came to the fore, where technology started to evolve much more quickly and started to be used. So it's seen to be like the industrial age is another way that you might have another thing that you might have heard of in history. So the Renaissance was about a revolution in technology, and it was a real rebirth of thinking about nature and humanity. It was a moment in time that we remember because it was a departure from what was going on before. Now, one of the most important advances during that period were the eyeglasses, and they're widely seen to have been one of the most important advances because what they did was they allowed people who had been experts in a field or who had been kind of key players in a particular area to stay connected for much longer than they had done in the past. Because eyesight fades with age, we get long-sighted and people's eyesight deteriorates for a number of other different reasons. What was happening is that as people kind of reached what we would consider to be now middle age, they could be less connected with the field of science or knowledge or understanding than they had been in the past because they couldn't see anymore. So we can actually think about that in terms of what's happening today as well. We have such a kind of increase or an influx of technology. The world is again changing very fast, and that's one of the reasons why you really need to develop your own critical consciousness and your critical understanding of things that you read as well, because you are likely to be bombarded with information at an ever increasing rate throughout your career in complementary medicine. During this period, it was also a period of world exploration, and it led to people to be exposed to a whole lot of different ideas about health and healing. So there was some creativity that went on during this period. During this period, we have the birth of traditional homeopathic knowledge, and Samuel Hahnemann. He's widely understood to be the founder of homeopathy, and he was a German physician who earned his Doctor of Medicine in 1779. And this is in this era of the Renaissance, which is an era characterized by industrial, technical, and social revolution. So scientific advances were beginning to be seen in the fields of chemistry, physics, physiology, and anatomy. But the clinical practice of medicine at the time was still rife with superstition, lack of scientific rigour, bloodletting, and all sorts of things that actually weren't scientific, didn't have a scientific basis. So Hahnemann recognised this and wrote several papers on topics such as arsenic poisoning, hygiene, which was hygiene and personal hygiene and hygiene in populations, dietetics, and psychiatric treatment. So you can see even right from the beginning, he had a history of kind of challenging traditional medicine, traditional Western medicine. Today, his principles are known as the law of similars, and this is the basis for the use of homeopathy. Now, one of his key texts his key texts are the Materia Medica Pura and the Origin of Medicine. Now, this is the Materia Medica Pura. Bear with me because, again, I can't see myself, but I hope you can see the book that I'm holding up. Now, I'd like to read you a passage from this book because for part of your assessment, you need to go back and look at traditional sources of knowledge. And I just want you to be aware when you're reading them, they're going to be pretty tricky to read. Now, this is the first sentence of the first chapter of the book. And this is all one sentence, by the way. So he begins with, next to a knowledge of what there is to cure in each particular case, which presents itself for treatment, There can be no more necessary knowledge for a practical physician than an acquaintance with the curative implements to know, namely, what each of the remedies can certainly cure. Now, although we can completely, easily understand what he says there, you have to be aware that that is a 4-sentence or more than 4-sentence, for a 4-line sentence, and also that it is written in a way which is quite difficult for us to understand. Okay, the next type of knowledge or way of knowing that I want to think about is musculoskeletal therapy, also known as myotherapy, which we teach here at Endeavour. And this is a definition of musculoskeletal medicine from the Australian College of General Practitioners in 2014. And they define it as musculoskeletal medicine embodies all medical disciplines that deal with the diagnosis of acute and chronic conditions affecting the musculoskeletal system in adults and children, including the psychosocial impact of these conditions. So the techniques were originally devised by Fred Mitchell Sr., and Mitchell's technique was known as muscle energy treatment. So we can be fairly sure that some of his knowledge and understanding came from earlier understandings of energy in the body. Mitchell's credits T.J. Ruddy's osteopathic rhythmic resistive duction therapy as a major source of inspiration, and Leon Chauto's book Muscle Energy Technique outlines the works of Ruddy and Mitchell Sr. And if you want to have some more, more detailed or in-depth look at musculoskeletal therapy, have a look at the link which is embedded in this slide.